In today's inspiration, I would like to talk a little bit about the capsular pattern in the shoulder. And what is the capsular pattern? Well, that's a kind of clinical image where we see that there is a restriction of movement in lateral rotation more than elevation, and elevation is more restricted than medial rotation. Where is this capsular pattern coming from? Well, in acute cases, this could be the result of a protective muscle spasm reaction. In more chronic cases, this is the result of structural changes in surrounding shoulder structures. But imagine we find a capsular pattern. What does that mean clinically? Well, we think of arthrosis or arthritis. And let's imagine the patient has an arthritis. How can we get an idea about how irritated is this shoulder? And let me share with you in this film a simple trick. You ask 3 questions to the patient. Do you have pain at rest? Can you lie on that side? And do you have radiation of pain that goes further than the elbow? If the patient gives 3 times an unfavorable answer, there is pain at rest, I can't lie on that side, and I have a lot of radiation of pain, then this shoulder is really very irritated. We call that a stage 3 arthritis. If you get 3 times a favorable answer, I don't have pain at rest, I can lie on that side, I don't have too much radiation, then it's more slightly irritated. A stage 1 arthritis. And why is it interesting to know that? Because the treatment strategy for a very irritated shoulder is a little bit different than for the slightly irritated shoulder when we talk about arthritis. In a stage 3 arthritis, we're going to focus on distraction technique. At the beginning, not too much mobilization, not too many exercises. This is too painful. In a stage 1, we can focus on intensive capsular stretch in all directions, intensive exercise, home exercise. So 2 different strategies. So perhaps that's interesting to know.